Hi, we'll speak today about a very common skin disorder, which is eczema. I will show you a natural, complete, and without cortisone solution for eczema. So let's see the plan for today. Definition and incidence, risk factors, complications, conventional treatments, Calendulis cream, and add-on products that could be helpful as well. So let's dive in. Definition: eczema is an itchy, non-contagious dermatosis. So of course, you cannot get dermatosis like eczema. It is not something that you catch. You develop per se eczema. It is characterized by inflammation of the skin, accompanied by redness, fine blisters, scales, and itching. It can start very early in life. We can see even in infants eczema. People with conditions experience a period commonly called eczema flares, so during which symptoms worsen. These attacks of varying duration would intersperse with period of remission. So you get it, and then you have remission for a few days, a few weeks, and then you get it back again. The mechanism of eczema is not yet well understood. It is thought to affect both the immune system and the skin cells that act as a barrier for allergens. Eczema is said to be a genetic disorder, but of course factors such as presence of chemical irritants or stress will influence its onset. Now, incidence, well, this skin disease is the most common. The disease accounts for up to 30% of dermatology consultations. In industrialized countries, it would reach 15 to 30% of children and 2 to 10% of adults. Recent estimates suggest that eczema cases have doubled and possibly tripled in the last 30 years. Risk factors. So I already said that this disease has a strong genetic component. Well, there are many factors that can make it worse. So let's review them just to make sure that we know what they are, those risk factors, and by avoiding those risk factors, of course, we can prevent the disease to flare up. Irritation caused by contact with the skin. So anything going from synthetic fibers, whole soaps and detergents, perfumes, cosmetic, even sand or smoke of cigarettes could cause the eczema to flame. Allergen from food, plants, animals, or air. Acidic foods also could contribute. Moist heat, so hot shower, for example, and wet and dry skin, frequent wet and dry skin could trigger also eczema. Emotional factors such as anxiety, relationship conflicts, stress. It is of great importance and now more and more recognized as being an impact that will exacerbate many skin conditions, including eczema. Skin infection, for example, athlete's foot, would make it more common for people that have that type of problems to develop eczema. Now, complications, I put two here. You see on the slide on the first two, the impetigo. So this is created by a bacteria called Staphylococcus aureus. So on the skin, we have bacteria with which we live quite well. There is no problem with that. However, when we have eczema, it is already a kind of door open for those bacteria to go a bit more in depth in the skin and create infection. Of course, with the scratching caused by the itching effect of eczema, it exacerbates that. And you could develop an infection called impetigo. And it is very much characterized by this kind of crust that looks like a crystallized honey on the skin. And it is then a complication that we should go ahead and ask our patient or client to see the doctor for a prescription. Cellulitis, that's the leg that you see there, is characterized by swelling. Normally the skin would be tender, would be very red and very hot as well. So those two conditions require a quick consultation from a medical doctor and very often an antibiotic that would be applied on the skin or taken by mouth. Conventional treatment now, of course there is no treatment that could cure eczema. This is not something that we could get rid of. So our intervention will mainly be limited to reducing inflammation and alleviating discomfort, like itching, for example. So the main medications are corticoid, of course, mostly topical, but it could be taken also orally for more, I would say, developed type of eczema. Antihistamines are also used when there is an allergic, a strong allergic component to the eczema. Immunomodulators are a kind of new group there that could be very useful for some patients, and antibiotics, of course, if there is an infection. Ultraviolet ray treatments are also used on some instances with good results. And psychotherapeutic approaches, of course, when there is a strong component of stress and anxiety, this is something that we should definitely consider and add to the treatment. Now a few words on the Calendulis cream. It is a solution that is 100% natural, that is complete and cortisone-free. The active ingredients are 3 organic mother tinctures, calendula, hydrocotyl, and propolis, and a mixture of 5 homeopathic ingredients: graphites, medserium, natrum muriaticum, alumina, and bilis, all in 5-CH. And the cream has been developed to be as natural as possible, still to hydrate the skin, but to be very natural. So the cream is without cortisone, petrolatum, silicone, synthetic fragrance, phthalate, PEG, GMOs, or parabens. So we make it as clean as possible with regards to the cream. Now, to complement Calendulis cream, we have developed a Calendulis tablet. And the reason for that is in the homeopathic treatment, normally we try to get our patient to go back to their health balance. And in order to do that, we combine an internal treatment with a tablet, and of course we can apply the Calendulis cream on the skin as well. I listed here the active ingredients of the tablet. Those are the main ones that we see in dry type of eczema that will cover the inflammation, the itchy sensation, as well as the allergy component of eczema. As well, we have developed a soft cleaning bar made from fresh goat milk and calendula. This is a local farm with which we work, and they are doing a great job there. So this is interesting for people that will have a very sensitive skin and like to have something soft to clean their skin. Finally, as a conclusion, for more than 20 years now, Calendulis has been helping thousands of patients, young and old. For more information, you have a little flyer that you will get some more information. And I invite you as well to go on our website, ziran.ca. Thank you very much.